views and perspective on how digital health solutions are used across India and US to manage the COVID-19 outbreak and beyond that. We all are going through an unprecedented time, and it's very important for all of us to understand that digital health is the way forward. And with digital health, virtually you can reach out to maximum number of people and offer them targeted intervention so that both provider and payer can keep a close eye on who is at risk and what might happen in future. With that being said, I just want to quickly introduce the agenda for today's discussion. So it will be a very straightforward discussion. We'll start with a round of introductions. Panel members can introduce themselves, and then we'll jump on the discussion itself. We'll keep it as much interactive as possible. The discussion will be split in two different ways. The first round would be based on what each of us has been doing in the digital health side to address the patients and population's need in this time. And then the second round would be more of a Q&A. There is no separate Q&A session dedicated for this session, but we can still go ahead and ask questions to each other. We'll keep it as a discussion, not as a debate. But then definitely I would encourage everyone to ask questions to each other. There's so much to learn from this panel. And I would like to thank Voice of Healthcare also for putting this together, for bringing stakeholders and thought leaders from different sphere of the healthcare ecosystem, from policymakers to consultants to actual CEOs who are running the show on the ground every day in India and in the US. So with that being said, I'll quickly request all of you to introduce yourself. We'll start with Vikram.
Hi, everyone. Thank you, Koustav, for the welcome. And it's great to be sharing this panel with this other panelists. It's a pleasure to be here, even though in these conditions which we are going through. And I'm Vikram Anand. I am presently the Chief of Strategy of a venture called THB. It's a clinical analytics venture, and have been in the health sector for about 25 years now, having worn various hats as a hospital operations lead guy to a consultant in various capacities in organizations, global organizations, and the last 5 years as an entrepreneur. So it's a pleasure to be here and try to be able to put together my experience and learnings through this journey, and especially in this last 6 months, 3 months journey together in sharing what we have learned across in the sector, how it's grown and come about, and particularly as to what as THP we are doing now in this space, particularly from a digital health perspective. So would love to share my experience and learnings here with you, all of you.
Okay, Raghuram is next.
Hi, this is Raghuram from NASSCOM. I've been there in the industry, predominantly coming from the manufacturing background. I started 30 years back. Getting into digital health part of it was about 3 years of my journey with NASSCOM. But I've been working on the clinical trials platform, working with the life sciences industry for a little over about 7 years. And as part of NASSCOM, my charter is predominantly to build a kind of a huge ecosystem around implementation of the latest innovations coming out from Indian entrepreneurs as well as tech industry. And the ecosystem, if you look at the supply chain of healthcare, it's not just the hospitals, you know that. Basically, we figured out it's the supply chain starts from pharma companies to life sciences, biotechnology organizations, health insurance organizations, medical devices companies, and hospitals plus startups, tech companies are investing in it. So how do we actually build all this, the ecosystem together with the help of the most important factor in the healthcare is about the regulatory, the government, and the regulatory bodies coming together. So we work on 2-3 things: discovery of the best innovations in the country, and looking at the adoption index, adoption levels by the healthcare delivery organizations, and wherever possible, take the voice of the industry towards the policymakers and represent the voices of the either the startups or tech companies or the hospital medical professionals. So it's a kind of a very brief agenda, and we have recently launched a huge initiative promoting the digital health and discover, design, and scale. So we work with a lot of government agencies as well as the private industry. So that's about. I look forward to be there in this discussion to learn a little bit about the perspectives coming from the other part of the world. Thank you.
Thank you, Raghuram. Saurabh, would you like to go next?
Sure. Hi, everyone. I'm Saurabh. In my yester life, used to be a consultant, much like Koustav. I was working with McKinsey, focusing a lot on the healthcare ecosystem, and then, like Raghuram said, various parts of the healthcare ecosystem, starting with pharma manufacturers, pharma distributors, supply chain, healthcare providers, healthcare insurers, and so on and so forth. But then decided to take entrepreneurial plunge a few years back. This is actually my third venture now, which is called MEDDO. In MEDDO, what we're trying to do is basically trying to bridge the online versus offline gap in the outpatient care, right? So what we're trying to do is upgrade, standardize, and I would also say digitize the care being provided through the bulk of mom and pop single doctor shops that exist in our country, right? So 88% of all clinical establishments in India are actually single doctor establishments, which kind of don't fall under the purview of any managed, I would say, brand managed technology or managed care, right? So we're trying to kind of aggregate those and bring them under one brand, under one technology called MEDDO, right? So in doing that, we kind of also upgrade them into full service health centers, which is our belief how health should be provided. The patients should not have to go to 10 different places after visiting a doctor just because the doctor shop today is a consultation box and nothing else, right? So trying to upgrade them into full service health centers, trying to provide all healthcare services under one roof through online and offline hybrid route. We started in Delhi about a year and a half back now. We have about 300 plus clinics that we have now rebranded and brought under the MEDDO brand. And our online platforms are open for the entire country. Yep. So that's what we do. A quick introduction about us. Thank you so much.
Thank you, Saurabh. Murali, you're next.
Thank you, Koustav, and good to meet you all. Just a little FYI for more, if you're noticing, it's about 9:40 p.m. Pacific time for me right here in California. So I'm glad to be part of the panel here at this hour, and very happy good morning, Monday morning for all of you, and a happy good week ahead, I guess, and glad to see some home friends again. So without further delay, so my name is Murali Athuluri. I currently work for a population health management company called Acadia Healthcare Solutions. We, as a director of technology operations, and I primarily work with several of the community health centers, as well as health insurance companies and healthcare providers. And in my current capacity, in fact, it is very timely that, Naveen, our voice of healthcare, has reached out to me on, what is the digital front about COVID-19 and what's happening. And, in a very timely way, we're currently deploying a lot of COVID-19 patient stratification strategies and analytics to all of our customers, pretty much at free of cost. And that is something that we are seeing a significant movement in the marketplace all around the United States with the current pandemic. And before this, I used to work for a company called Massachusetts eHealth Collaborative, which is a non-profit organization. I've been there for over 6 years, and the company recently got acquired by the Acadia, so that's how I transitioned into this new place. I've been in healthcare industry for over 14 years now, and worked in different capacities as a chief strategy officer or a chief strategist, as well as healthcare informatics analyst and a technologist for several of the independent physician organizations, providing both on the clinical side as well as on the revenue cycle management side. I do share a little bit of experience what Saurabh has explained earlier, and a little bit of what Vikram had mentioned. I've done both entrepreneurial gigs over the last 10 years. I've also have an organization in India where we do packaging services for pharmaceutical companies, which is a manufacturing business, right? And although I'm primarily more on the IT strategy, but over the last decade, I've been doing a lot of healthcare operational strategy on improving care delivery. And that is where I've actually met one of your co-founders of MEDDO, or Voice of Healthcare, Naveen, who in one of my previous classes at Harvard, when we were both attending the Managing Healthcare Delivery at HBS. So it's really good. I know a lot of great work Voice of Healthcare does. I've been watching you guys over the last couple of years, and it's really very interesting to see how you are bringing all of the care delivery improvements and managed care practices, and bringing all of these great leaders and knowledge base into one hut, and trying to use your voice to share and collaborate and improve the care in the best way you can. So glad to be part of this panel, and I hope this becomes something that is very productive and helpful to the rest of the community who is watching us live on Facebook.
Thank you, Murali. We appreciate your time. I know it's Sunday late night, so you being on the panel and sharing your views with us, it's something really, really amazing. And thank you for your time today. So we exactly have 30 more minutes for the discussion today. We have spent 14 minutes in introduction and setting the agenda. So I'll quickly kick off the discussion and request Vikram to share his point of view on what digital health is all about. I know that I have been doing this for a long time for my global leaders, and even though some of the global leaders do come from mature markets like North America and Europe, still healthcare leaders constantly ask me, how do you define digital health? How do you scope the digital health intervention so that we can make a more informed evidence-based decision when we embrace our digital transformation program for our healthcare business? These healthcare leaders may come from the pharmaceutical background, may come from the medical imaging background, but they do ask us, how do you define digital health? So in the context of India, Vikram, you've spent decades in this industry, and having worked with so many different leaders from all over the world, I would like to request you to first kind of define the market from Indian context, and then focus on what exactly you are doing on behalf of THP to manage the COVID-19 outbreak in India.
Sure. Thanks, Koustav. So let me start by saying that this current pandemic, though has been challenging, but in a way, how I see it has provided us with countless lessons and clues in preparing us better for the future. Having said that, there's a very interesting move we are getting to see, that how it has unearthing or reinforcing the consumer behavior and actions on defining how fundamentally healthcare is going to be practiced tomorrow, and what healthcare we may have seen in past as how it works. And that's a very interesting observation which we are seeing, that the consumer here may just define how the digital health practices is going to get more into the mainstream across the system, across the organization. And my view, let me start by saying, is going to be primarily from a South Asian perspective. India for sure, but largely a South Asian perspective. And that's where later Murali it'll be a pleasure to hear Murali reflect upon from a US perspective too. And having said that, there are about, when I see the changes in the behavior of consumers, there are primarily about 6, if I was to put 6 healthcare models in terms of a digital health, which will help transform healthcare for tomorrow. There would be approximately around 6 broader buckets or areas which I could kind of define as how I see digital health making an impact across the industry. And I'll just call out those 6 areas and then maybe kind of dwell upon them. And some of my colleagues will probably reflect in detail about those areas also. But primarily, if I was to say, and these 6 buckets in a way also cover a very important aspect, which in India and South Asian countries we are very conscious about, is cost, is accessibility, affordability, and quality. These 3 parameters are well touched upon or in a way covered by these 6 models, healthcare, digital health models, which we are looking to transform the way healthcare will work. Number one being telemedicine. And when I say telemedicine, I'm covering teleconsulting as well as tele-ICU care, remote care, etc., where we are bringing care closer to the patient, removing the financial barriers by getting closer to the patient through telemedicine, and in terms of care, and also in a way taking care of the disparate resources which we have across the country, especially doctors, being able to cover a larger community across the country very comfortably. So telemedicine is number one area which I would like to reflect upon. Second being point of care devices. Point of care device again helps us manage more across the community and across the regions, and being able to manage their disease, manage their diagnostics better across by reaching to them wherever they are in terms of rapid tests and other diagnostic tests, which are all point of care tests. That's the number 2 digital health function or a model, which is something which is interesting to be seen how it develops and how people get to use it. Third being automation, artificial intelligence, and healthcare analytics, and the EHR kind of a bucket. And I'm kind of trying to put it all together in terms of analytics, real world evidence, AI, because this not only takes care of tools from epidemiological purpose for measurements, it also covers supply chain, medicine systems, etc., through supply chain, e-medicines being ordered for, and various other mass diagnostic tools, AI tools, which are being built across for management of care. And this is an area where THB also closely works on in terms of real world evidence, clinical analytics, and I will come down to the real world evidence and digitization particularly, as I mean to say.
Sir, just wanted to interrupt you. Apologize. You have 3 more minutes.
Sure, of course. I'll finish. I'll wrap this up. And the fourth area being digital therapeutics, which is again being able to manage your medicines and medical care yourself. Fifth being medical equipment and devices, which we can now look at as ventilators and ophthalmic devices being made in India. And lastly, which is very important, is the patient awareness and doctor awareness platform. These are 6 broad areas in digital health which I would want to reflect upon, or which others can also add to. From a THB perspective, we are primarily focused during this COVID for being able to create a telemedicine solution which brings the patients closer across, and for the hospitals and providers across to be able, and doctors to be able to communicate more effectively with their patients and ensure that their care is very well followed up with. The second area where we have primarily focused on and have earlier also worked around in terms of real world data and digitization, because the implications of clinical analytics, real world evidence data and digitization has on epidemiological monitoring to be done, which will help in further identifying the hotspots and locations. And this is just not for COVID, folks. Where I want to bring the attention is that this kind of real world evidence monitoring through surveillance has an implication on various other vector-borne diseases. And we have done it in the past. We have built prevalence apps, platforms for vector-borne disease management and for vector-borne disease kind of monitoring. And it has worked very well. But yes, now it has to be put with organizations like NASSCOM and others to come work with. It needs to be taken to scale. Likewise, we have built algorithms and models using the worldwide research which has been done on COVID in terms of seeing how clinical decision tools can be built for the doctors to be able to manage these cases better. But would be even better if the same could be done using the algorithms could be done building the Indian data, using the Indian data. And that's where all of us together come into picture. Organizations like NASSCOM can take a lead in terms of creating registry of this data set, where this can then be taken in building analytics, doing a lot more in clinical analytics and insights being provided to hospitals and doctors, being able to create and identify hotspots for better preparation, and for being able to prepare tools, decision support tools for better disease management. So I'll leave it here at this point, and maybe I'll come back on some other areas where I see a lot of homogeneous connect amongst the partners to work together for creating and managing healthcare better across. Thank you. I'll stop here. Koustav, over to you.
Thank you, Vikram, for sharing your feedback on the clinical side of healthcare and how digital health applications can be used to manage population health at scale. Now, speaking of population health, I know that Saurabh's company MEDDO has been doing quite an activity on that field, and over a very short period of time, MEDDO has been able to connect different primary health clinics, and you're doing it successfully across many cities in India. So I just want to learn from Saurabh, how did you achieve that connected care ecosystem, and what was your journey, and what's the future ahead for MEDDO post COVID-19?
Yeah. Thank you, Koustav. I think, you know, to be honest, when we started or were starting MEDDO, I always felt like an outsider, yeah, to the healthcare industry per se, because everybody here has like decades of experience, right? Even if you look at the panel, I always feel like, you know, there's a voice in my head always saying, only say something intelligent, these guys have years on you. So they'll, you know, they'll catch you in your tracks. So, so I think, but when we start peeling layers, we figure out that at the core of everything is something very simple. It's a very simple supply demand. It's very simple alignment of interests. And it's ultimately the core proposition that different entities are offering each other. And I come from a very marketplace background, right? So even my previous two organizations, Print Venue was an online printing marketplace. Food Panda was a you know, marketplace for online ordering from restaurants. So what you need to be able to understand is, who are your core customers? For us, the core customers today are the patients and the doctors, right? Being a marketplace, you always have at least two sides that you cater to. And what is it that they crave the most? What is the need of the hour that you need to solve for? And can you bridge that gap with enough incentives for everybody to partake? I think that was something that was at the core of it. And once you have that cracked, I think scale is eventual, right? Luckily for us, we could kind of gallop at a speed which honestly even we didn't fathom when we started. Our initial you know, estimates of where we would be in 1 year's time were about 1/6, 1/8 of where we see ourselves. So we kind of found ourselves a bit lucky that way. We grew beyond our imaginations as well. But again, like I said, the core of it, the essence of it is always kind of creating the right incentive model where whether it's patients, whether it's doctors, find it in themselves to be part of the network, right? So with that, coming quickly to thereby, what does it mean now, and how what we have done has helped, right? So the biggest problem when it comes to healthcare is actually mindsets. Health is a very it's a very touchy subject, right? Because you're dealing with lives, you're dealing with people's well-being. So the propensity to experiment is that much lower, and rightly so. In such an environment, bringing in things like digital, etc., we've been trying for the last decade now. But sometimes they just need that little bit of extra external push, an external catalyst. And while it's very poor situation to be saying so, but I think the silver lining of the current pandemic, the epidemic, has been that suddenly everybody is now open to see what digital can do, how little, even if impact or a role it can play in providing accessing, and like Vikram said, whether it's from accessibility perspective, whether it's from affordability perspective, and to be honest, even from quality perspective, a very good first front. You know, the jury is still out, honestly, on how long or how far can telemedicine go in an individual capacity, not being not being monitored by a health worker on the other side, right? So we are all trying to experiment. What we know is that where we find ourselves is a good start. I think with this, what has also come to surface is the few gaping holes that we as tech organizations, as telemedicine organizations, as digital health organizations still need to fill. So I think on both sides, those are good news, I would say, because by seeing what is lacking, we figure out what to improve on. Yeah. Which also means that there is usage that is being driven, which kind of gets you to surface many more use cases that you didn't previously think of. So from that perspective, I think it's a fantastic first step. As MEDDO, what we have tried to do is make sure that the platform and the physical boundaries are not constraints for anybody to access health at this point. To that effect, we have actually opened up our telemedicine platform for all doctors for free. So any doctor across the country can actually today get onto MEDDO and use our telemedicine platform to treat their patients. And we are not going to charge anything from the doctor. The doctor can feel free to charge whatever they want to from their patients. But the platform is for them available for free, so that, like I said, in this current time of need, they're not limited by physical boundaries. The second thing that we had done, and now the court has specified that it's only going to be for Ayushman Bharat patients, but we had actually launched free COVID testing for patients through the MEDDO platform. It's now been rolled only to the Ayushman Bharat patients as directed by the government, but earlier we had rolled it out for all patients, irrespective of economic status. And thirdly, we have been helping a couple of state governments in terms of tracking the quarantine and tracking the high-risk patients, right? So that's been another one of the things, that contact tracing, and not only contact tracing, regular follow-ups on how these patients or these suspected high-risk patients are moving through the system becomes very important, especially when you're quarantining lakhs of people at the same time. So we kind of developed a quick software, IVR-based software, where there are regular touch points, and based on whoever needs medical help at a point, the call is routed automatically. So that was the third solution that we've done for certain state governments. So I think those are steps we have taken. Again, the idea at the core of it being bringing everybody onto a platform so that we are not limited by physical boundaries to be able to deliver timely quality health to our patients.
Thank you, Saurabh, for sharing your feedback and journey with us. I would quickly like to approach Murali now, and I want to share some background information with him. I know that he's working with academia, and Frost & Sullivan has a huge history with Arcadia. Back in 2016, I was working with Greg Chittim of Arcadia's product team and his team to evaluate Arcadia for a Best Practices Award. And as a result of it, in 2016, they won the award of North America's Best Analytics Company for the population health management market. And since then, I've been working very closely with Arcadia's team. And I know what Arcadia does in the population health management space in terms of clinical risk stratification, data analytics, and providing predictive solutions to both payers and providers across almost all states in America. So really trying to understand from your end, Murali, based on what you've seen in today's context, in the COVID-19 context, what are the core challenges your customers are facing now, and how you're addressing those challenges with your tools and services that you offer today? Murali, I think you're on mute. I cannot hear you.
Hold on. Yeah, you're right. Sorry. Thanks for the tip. Yeah, now you should hear it. Can you hear us?
Yes, I can hear you. Thank you.
All right. Okay. Yeah. So, so I was just saying, yeah, you're spot on when you said, Arcadia is pretty much a population health tool leader in the entire United States. And over the last few weeks, all of our energies have been on how can we help. Rather, I should say, how can we be a partner where we can empower all of our customers with the rich data and the R&D that we have done so far with millions and millions of data, EHR data that we have from several of these customers. And to that extent, as I said, the challenges that particularly in the United States market that most of the healthcare providers are constantly facing is when it comes to reimbursement model. And what I have seen personally in my experience is today, because of the COVID pandemic lockdown and shutdown of all of the resources and social distancing, it kind of made way for telemedicine to grow into the primary delivery of care. So the barrier earlier for telemedicine was reimbursement model. So organizations and healthcare providers were like, I'm not going to get paid for this service, so I'm not going to be very interested. And also people were constantly questioning, what about the privacy? What about the recording? How effective would it be? How do I know that I am not intruding into someone's space, or what if I get any litigation or legal issues because of that? Now, with COVID, because they did not want anybody to come in physically unless and until it is an emergency, people started being very creative. They started using FaceTime. They started using WhatsApp video. They started using even Zoom. They started using all kinds of even proprietary telemedicine tools like what Saurabh just mentioned, like MEDDO or any of the local vendor organizations. And they are really, they're calling it in different ways, right? While there are challenges with the technology, even, a lot of people do connect United States to saying it's one of the most advanced when it comes to technology. But when it comes to the people that are vulnerable to COVID conditions are the ones that are not very sophisticated. These are mostly homeless people or people who are in desperate need of maybe they're challenged financially, they're challenged in where they are from a geographic perspective because they do not have proper access to the care. So it goes back to one of the points that Vikram brought up earlier, right? So cost. So these are very huge barriers. Like some people cannot even afford a 4G service or a telephone service or a smartphone service. So how do you reach to them with telemedicine? First of all, how do you even make a contact to these patients who just based on the historical data over the last few years that we have seen and based on the existing medical conditions and the diagnostics that we have, we were able to stratify high risk, medium risk, and low risk patients. But how do you make sure to reach these patients, right? And so those are some of the barriers. Especially, I would say, reaching access to the care and making sure even the provider community is able to reach the patient. And also, how do you know the patient is even aware of the fact that where do I go? So that goes back to one of the points, 6 points that Vikram, you raised, right? Awareness. That's basically education, right? Patient education and provider education. How do providers think about what are the tools that I have at my disposal, and how do I document that information so it can be used as an ongoing learning process to improve myself in the coming days, right? Today, mostly we are able to probably just make a contact, but you don't know. Like even in some cases, the patients that they wanted to see, where we see that, based on the data, we stratify them as high risk patients. But if they do not respond, how do you provide the care? How do you make sure they are safe? And if you are not able to get in touch with them, there is a high risk of them increasing the spread of the virus, right? So these are the areas I would say from a COVID outreach perspective, right? Now, the second challenge that we have seen is, the definite financial strain it's putting on the entire healthcare system, right? People have to close down, like all the small clinics, and like luckily now maybe organizations that have this capacity like MEDDO, who are under one large umbrella, they are able to survive. But single doc physicians, and I can give you examples. My father is 74. He has his own practice in a small town called Kochhar in India, and he has to close his nursing home, right? And for a single physician practice who doesn't use any tools and technology today, if because of the lockdown you shut down the office, then you have no visits. That means you have no revenue whatsoever. How long can they survive? So practices that have 2 or 3 physicians, they are really struggling because their day-to-day livelihood, not only for themselves, but also for the entire staff, like the frontline workers, like nurses, physician assistants, labs, technicians, all these people, they're all dependent on this. So the challenge for them is how do you basically take care of these people, right? So that's one part. The other part is still a challenge is, interestingly, some organizations, they do not have clarity on whether if a patient belongs to a state-provided healthcare service or a commercial health plan, how do you get paid for those services that you render? It's not like cash and carry business in India, right? Most of this is based on the reimbursement model, and although the government is trying to implement some of these processes, they're still trying to figure out whether I will get paid or not. So those are some challenges that we are facing right now, I would say.
Thank you, Murali. Now, I would like to quickly approach Raghuram to share his view on the policy side of things. You've heard Vikram, Murali, and Saurabh, and you can imagine that the startup community as well as the more mature healthcare IT companies are geared up to offer solutions even for free to patients and consumers to ensure that they manage their crisis more effectively and efficiently. So from NASSCOM's perspective, how do you envision the future to move ahead where smaller companies are teaming up with bigger players and you are incubating those collaboration on a top level to ensure that everyone has access to meaningful targeted tools at a population level, not only in India, not only in the US, but cross-boundary collaboration should also happen. And how do you ensure that NASSCOM is at the forefront of enabling that?
Thanks, Koustav. Great insights from basically the previous speakers who set the context and made me a bit easy on what is a digital health.
Yeah.
Apart from that context, for me, digital health, I don't want to define what is digital health, but what is the outcome, what I expect from digital health is 2 aspects. One is the patient experience, second is the doctor's experience. And most of the times we talk about patient experience, we forget about doctor's experience. So one of the, recently we were talking to one of the general practitioners group in Europe. They had done an analysis and how much time the doctor spends with the patient. That can be improvised without sacrificing the patient's feeling about doctor is not spending enough time. So when we implement technology, the doctor should feel, yes, it is helping me, and patient should feel it is helping me. Okay, that's one view I would like to give before I come back to your question. The second part is, you talk about a food, distribution app. We go to Swiggy's, we go to many of the apps which is actually supplying food chain. When somebody is going and ordering for a food, they do not think about what platform, what technology, what microservice. Basically, they look at what is that item I would like to buy, how fast can I get, what varieties I have, and who's the nearest place who's serving it. Okay. Now, similarly, when it comes to the future of healthcare, the future of the digital apps, which we are trying to look at, people are not going to look about what point of care devices, what is the accuracy, what is, what is the kind of a, solution, who is the doctor. Basically, they are trying to look at what is the experience they get. And I also like to take one of the examples quoted by Saurabh. He said patients should not go to 10 different places. In fact, there is one more study which we have done with some of the international doctors in Punjab. One of the things which came out very well, forget about going to 10 different places. The patient cannot come 10 different times for 10 different types of problems. So are we able to catch the most of the possible conditions of the patient in one visit, because every visit costs time and money for the patient. And because of that, the patient conditions are getting worse, especially in the rural setup. So that is a very important factor we are trying to solve when we actually trying to encourage the startups. Now coming to the context of the COVID, I think I would like to salute the doctors and the government and the entire medical professionals of the government for the kind of a response they have provided across the world. It's not just one government or one country. The most important factor which has come out is about three or four dimensions we are trying to work on. The dimension one is about tracking and containment measures. So what kind of solutions which are coming, how do we encourage them to? But there's a lot of redundancy. Many people started coming out with a very simple, okay, I would like to be famous with COVID solutions. So an organization like NASSCOM, it becomes very difficult for you to scan through hundreds of such requests coming from. So we need to really take take out the best solutions. That is from the content perspective. The other is about the testing and diagnostics. You see the kind of innovation which has come out in the testing kits. So how do we help the organizations to get the regulatory approvals? So it's not easy. Like you look at the COVID patients' data. As such, the healthcare data is confidential. Now, COVID data is becoming sensitive. So sharing this information, federating this information is something which is becoming a kind of a challenge in these times. I think we are trying to work with the certain agencies to help this data made available, at least for the research institutions. Now, if you talk about the cross-border collaboration, where there are stringent measures about data sharing, we need not worry about those geographies, but across the borders, we have certain data available. If that data can be made available to the researchers across the world, not necessarily. If somebody is doing a great job in, say, Philippines, somebody is doing a great job in Korea, somebody is doing a great job in Sri Lanka, we should be able to federate that information, give it to them and say, okay, now I have the patient demographics. I give a very simple example about an analytics, what we're trying to build. Now we have what type of a patients, what kind of a, existing comorbidities are going to be the cause of the death for patients based on the age group of the. Now, one part which is still missing, I don't know, maybe you can correct me, is about how is the recovery process along with the comorbidities. That data is still not available. I think we need to look at from the patient population. There are, like if you look at 70% or 80% of the population is recovering with a certain set of conditions. How is the recovery process? What are the kind of health conditions they have, and can it be helpful for our research? I think that is another area which I can see all of us can work towards. And the speed of approval and the kind of an urgency shown by the government is something we also would like to catch on. For example, one simple thing which across the world which made an impact, I think all the previous speakers spoke about, is the telemedicine. Now the telemedicine platform comes with a certain kind of conditions. Now from a technology perspective, as in innovators, are we actually following all the procedures defined as part of the rules like HIPAA compliance in telemedicine? Now we are trying to work on help the technology startups, technology companies to adopt to these standards, and soon we might have to bring all the players together and represent back what are the challenges, and that is where NASSCOM is predominantly working on.
Sure.
I'll stop here because we just crossed 3 minutes of beyond our scheduled time, but it's a lot many things happening, and we would like to collaboratively work towards improving the basic healthcare. And as somebody said here on the group, this is not about COVID. I think we all have to work towards beyond COVID.
Correct. No, I agree with you. And thank you so much for sharing your views with us, Raghuram. I know that Voice of Healthcare has recently signed an MOU with NASSCOM's COE to build applications in the real world evidence space. Exactly the point you made, standardizing care across the continuum needs to happen so that everyone receives healthcare which is standardized and international grade. So I think I have 4 key takeaways from this entire discussion. Number one is awareness, as Vikram mentioned, that awareness must happen across India. People should know that they have access to these tools. They can use it proactively for free of cost. They can reach out to providers for second opinion, third opinion. They don't have to rely only on their local providers. They can reach out to expert providers in India, outside India through these tools. Then second is accessibility. Access is absolutely important. I think startups and policymakers and consultants will play a very important role in enabling that across India. We need to ensure that through awareness, we also improve accessibility of care, not only within the urban realm of healthcare, but also towards the rural population where most of India's population reside, and most of the care inefficiencies are observed in that particular continuum. So definitely accessibility in rural and urban population through digital health is a must-have. Third is predictive intervention, as Murali mentioned, tools, applications, services that will enable providers and payers to understand where the gaps are, and they can offer targeted solutions to mitigate those gaps proactively without waiting for something to happen, is also a must-have. And fourth takeaway, which Raghuram mentioned very correctly, is collaboration. Collaboration in the strategy side, collaboration in the data side, to ensure that we have the data available with us, and whatever algorithms or tools we're building are built based on evidence that we can collect from different populations all over the world. So definitely awareness, accessibility, predictive intervention, and collaboration are the 4 key takeaways for me, at least from the panel discussion. And I had a great time moderating this panel discussion. I truly appreciate all of your time. We are 5 minutes over, but I am not complaining. I can go another half an hour to discuss in more detail, and definitely we'll follow up. Maybe we can schedule another discussion at a later stage to really give a roadmap to all of our audience in Facebook, where we are, where we need to go next, and what India and US can do together in the digital health side to ensure that both countries have access to targeted tools to manage population health. With that being said, I would like to conclude this discussion, and I would like to appreciate and thank all of your time. Thank you so much.
Thank you.
Thank you, Koustav.
Thank you.
Thanks, buddy. Thanks.
Bring this back.
Thank you. Have a good day, everyone. Stay safe.
Yeah.
Stay safe.
Yeah.
Thank you.
Bye.